So, on behalf of the Psychedelic Association of Canada, I wanted to welcome everybody who's joining us for our what promises to be a really interesting webinar, which is surgery as ceremony. Yes, that's right, surgery as ceremony. I've got Dr. John Kanevsky, I said that right, on the line with me today, and I'm really looking forward to getting into this. And I just want to let you know that if you have any questions, you're welcome to enter them in the Q&A portion of the chat. Please feel free if you've got anything you'd like to know firsthand. We'd like to keep this as informal as possible and still get some really interesting insights while I have everybody here online. So, Dr. Kanevsky,
Hi.
just just the title of it, right? You know, surgery as ceremony. Give us just an overview of how you even came up with that. What headspace were you in when you came up with that
Mm.
brilliant concept?
I was in surgery
Ah,
and
okay.
yeah, I was in surgery and I do a specific type of procedure that lends itself more to the experience that would gave rise to what surgery and ceremony is. So I perform mostly conscious sedation or awake surgery in the domain of plastic and reconstructive surgery.
Mhm.
And specifically, what I do is I focus on procedures in the breast for either breast reconstruction after cancer or as a primary aesthetic procedure. And as part of that awake procedure, I do fat grafting. So I move fat from other parts of the body to the breast. And often it's for patients who've had previous histories of trauma, whether it's a surgical trauma or any kind of emotional trauma through the journeys they've been in, whether it's related to cancer or even having had implants in the past. I don't do implant surgery. I just focus strictly on fat as a reconstructive or aesthetic technique. And so I was in surgery. I was in surgery when it came about. And the specific moment was when a patient had been recently medicated. And after about 20 to 30 minutes or so of the medication setting in, before the procedure had even started, she started crying and shaking just from this powerful emotional release. And I'd had experiences like that happen in the past. I'd say as much as like 10 to 15% of patients once they're fully medicated. And I use this was years ago, but in that context, that combination of medications in my mind kind of lets the ego down and everything that is so tightly wound and that patients are holding on to. Finally, the guard is down and their emotions can come through and they can feel expressed. And you pair that with any kind of fear or anticipation or anxiety about an upcoming procedure, it's really kind of a perfect storm to have this cathartic release. What really struck me in that moment, though, what brought about the concept of surgery as ceremony is that the particular way that this patient was crying, the sound of it brought me back to one of my own personal medicine journey experiences that I'd had years prior. And it reminded me of a woman that was sitting next to me crying and shaking. And it just hit me. It was like a light bulb went off. I was like, how is this any different
Right.
than somebody who's on an intentional ceremonial experience to transform their psyche or to have some sort of major shift in their life? And it was in that moment I was like, oh wow, what if I was to look at every surgery patient as undergoing a ceremonial transformation, and I honored that for them. So I gave them a chance to have a cathartic release if that's what they needed, but also to address this transformation in their body as well as a transformation in the mind and spirit.
Right.
And so from that moment, it's kind of where the concept of surgery as ceremony came about, which is, wow, it's no longer just surgery of the body. It's really a transformation of the mind, body, and spirit. It's a way to honor the transformation so that the mind can be ready to receive this new body as patients go through the recovery process. And from there came, iterations of a protocol that lent itself more to really honor that transformation.
Right.
But to answer your question, the moment, the sort of aha moment where it came about was in surgery that day.
And how long ago was that?
Um, wow, it's been about 2 years now.
Okay.
Yeah.
So that timing is really important too, right?
Yeah.
Because we were in the height of the pandemic.
Yeah, height of the pandemic. I can't imagine a time where people are holding on to more stress and
Right.
challenges. Yeah,
And
yeah.
that's really fascinating that for everybody who was going through, their thing, that you were in that moment able to connect with her on a level of, why should I care?
Mm,
Right.
mm,
And it resonated so profoundly with you that I find that really interesting, the timing especially. So
mm.
how did you get, now you care, it resonated for you. How did you now articulate that to, your team and your collective, your tribe? How did you get them on board with the concept?
Yeah, so it was a gradual process. It really took some time to think through like what, there's different iterations of this and everything from the sort of way to think about how to facilitate an environment for patients, all the way down to the nitty-gritty details of the medicine that's in which medications are being used and how the follow-up process goes. So suddenly it opened my eyes to like, oh, it's not just about the experience that's on the table. It's now this entire arc, this journey that patients go through that literally starts at the time of the consultation of, the reasons that they want to have the surgery in the first place. So what I did is I sat down and just looked at the entire patient experience as an arc, and I tried to think about, how if we were to treat this as a ceremony, how would each step of the process be catered to really supporting that kind of transformation? And the major similarities between surgery and ceremony to me were three. So the first is there is a strong desire to undergo a transformation. Whether a patient's having a surgery for their knee or an aesthetic surgery or anything, like you want to have that change. And the same for any other kind of ceremony, whether it's a week-long meditation retreat or a plant medicine journey or anything that's that intentional and wanting the transformation, there's the strong desire for it. The second is this altered or elevated state of consciousness. Just because we're using these powerful medicines that come from a pharmacological background and not necessarily are directly plant derived doesn't make it any less potent in the sense that it creates an altered state of consciousness, which in some situations can create a state of increased neuroplasticity or a more suggestive state for the brain, which again is similar to those altered states of consciousness and ceremony, be it through deep meditation or movement or a psychedelic. And then the last step is to have to undergo the journey. And so there's no, so you have to do the work, whether it's sitting through the ceremony experience, whether it's doing the meditation retreat or actually physically with the guide, with your shaman undergoing the surgery. So with that in mind, started this journey of like, oh, well, what are the ways that patients, the consultation process can be driven in such a way to really understand what patients' intentions are behind the surgery. And for me, it was really important. It's been increasingly more important as I go through my career to really make sure that I'm doing no harm and always doing surgeries for patients that are really in the right place to do them. Because I do believe in body autonomy, especially as it relates to aesthetic or elective surgery, that everybody has the right to do to their body as long as they're not causing significant harm to themselves or somebody else. But with that in mind, also there is a balance to that, which is, a lot of people have patients going into a surgery will have some sort of thoughts, fears, anxieties, traumas that are coming in, whether it's related to the surgery or not. So it's balancing that and making sure that, it's identifying any elements of body dysmorphia or perhaps other treatment modalities that would be better other than surgery. So it starts with the consultation, getting really clear on the intention and reason why somebody might be seeking surgery. And then in discussion with colleagues, one colleague in particular, Dr. Kapmeyer, who's a really talented psychotherapist who specializes in ketamine-assisted psychotherapy, I started to really realize the potency or the potential of like, wow, what if there was a therapy session before surgery? So before a patient ever set foot in the operating room, they had a dedicated number of sessions with a therapist used ketamine as a way to ground and set the intention for the surgery, but
Mhm.
also as a way to really help people get in touch with their bodies.
Right.
And the idea is to align the mind and the body in preparation for the procedure. So that leads me to actually the protocol for surgery ceremony. So what's the protocol and what's that about? Um, I can maybe towards the end I can share. I have a few slides that I can show, but I'll kind of talk through it at first.
Okay, yeah, that'd be great.
Yeah. So surgery, a ceremony, is a three-part process, and I alluded to it a little bit already in the beginning with the therapy component. But it starts with 3 sessions with a psychotherapist. The first session is a sort of introduction session, and it's really like I wouldn't consider it necessarily like the classic psychotherapy relationship between a client and a therapist, and that there's going to be like a long ongoing process. This is really more of like a no pun intended, but like a sort of surgical targeted approach. It's
Right.
like we want to really get in clear about what the intention is behind the surgery to address any fear, anxiety, or trauma, and also as a way to really understand and connect to the parts that patients may have that are in conflict related to the surgery, and
Right,
also
right.
to create resources that patients can use during the surgery because they are awake during the procedure. So that's anything from mantras, different kind of somatic tools, symbols, archetypes. So there's that introductory therapy session, and then there's an in-office ketamine session. So that's a 2-hour session with the therapist using a ketamine troche, a lozenge, and the dose will vary from 75 to 100 milligrams, sometimes a little bit more. Um, and that's where the client gets to really deep dive with the therapist and work, sort of set up the stage to do the work. And there's more and more evidence and good research coming out showing how ketamine-assisted psychotherapy is useful not only for anxiety but for depression. It has lasting effects, and it's particularly useful, I find, in this setting before a procedure to help address any psychological issues patients may have coming into the surgery, but also related to the surgery itself.
Right.
So after that ketamine session, they then have a integration session, which is done. That's the third session with the therapist, and that's really where I think the entire ketamine assisted psychotherapy process comes to fruition, which is we get to integrate anything that's come up. They've already established more of a rapport with the therapist, and a chance to really hone in on what the tools are going to be that get used during the surgery. One thing that I think is special about that process is that it's of course it's dependent on the therapist, but the therapist I've been working closely with, Dr. Katmeyer, is really I would say a skilled ceremonialist in the sense that she really holds space with a lot of intention, with music, with lighting, with making sure patients are comfortable. This is not a sterile medical environment. It's really like it's really a vibe. It's like a place
Right.
that you want to be comfortable.
Right.
And the music, I personally think, is one of the most important aspects, and I'll allude to it more later, but it's the actual music that gets played during those sessions then gets repeated. It's like this recall experience all throughout the
Right.
protocol. So it happens first in the ketamine session, but then I use that same playlist during surgery. And then I encourage for the third part of the protocol, which I'll talk more about later, which is body work, that music comes back.
Right.
And so it creates this powerful sort of like neuro somatic programming of the
Hmm.
experience, where even without the medicine on board, you get this sort of recall of the sensations and the emotions and continue processing. Um, I'll pause there because I'm going through the whole protocol and I want to make sure there's a chance to touch on anything. But that's step one. Step one of surgery ceremony protocol is ketamine assisted psychotherapy before a patient ever steps foot in the operating room.
Okay. All right. And then actually there's a question that popped up just would you mind mentioning the anesthetic protocol in the procedure you're describing? So I
Yeah,
guess
sure. So this might be a good time for me to transition actually into sharing my slides. But if somebody could enable screen sharing on the tech side, and I'll just keep talking about it. I'll talk through the protocol, and then once the screen sharing is up, I can pull up the slides.
There you go. You're the host now to share.
Oh, okay, cool. Here we go. All right, can everybody see that? Can you see?
Yep, perfectly.
All right, so yeah, we just briefly went over the first part, which is the ketamine-assisted psychotherapy, talking a little bit about ketamine. I'm not gonna. I can talk at length at the sort of the medical psychoactive sides, but what I wanted to focus on is the first part of the protocol, the medical side. So this is 1 week before surgery with a licensed therapist who's certified in ketamine-assisted psychotherapy, performing 3 sessions. So the first is a 60-minute prep session, which I mentioned. The second is a 120-minute session with ketamine-assisted psychotherapy in office in a monitored setting. Very important.
Yep.
Especially something we can touch on later, but the FDA recently came out with a statement against at-home ketamine use, which I think is significant given the trends in the industry and something to touch on. But just to clarify, this is an in-office experience that is in a monitored setting with
Okay.
an oral lozenge. And then the third part of the therapy protocol is a 60-minute integration session on Zoom.
Okay.
So now the other part of the protocol that somebody had asked about is more the surgery part of the protocol. And this is actually based on, there's no, I wouldn't, this has not been done before, the way that this has been synthesized. So I've used my best evidence for creating a protocol that I think has been abundantly tested to be safe in other settings. So the ketamine used for depression, which is a protocol that's being currently in use in Montreal, is what I base the protocol off of, and I'll go into more detail about what the actual protocol is. So the medication side, it's using the 0.5 milligrams per kilogram infusion IV of ketamine. Then for the surgery itself, so when I numb, I'm just listing all the medications I use in surgery.
Yeah, this is great.
I numb. It's called it's tumescent liposuction, which is the majority of the procedures that I do, which is putting a tumescent solution underneath the skin. So that's basically a numbing medication with lidocaine and epinephrine. And the other medication, I don't always use it, but sometimes I'll give a dose of a benzodiazepine. It's 1 milligram of alprazolam or Xanax. I reserve that for patients that have not had any kind of ketamine or psychedelic exposure before, just to make sure that they have as comfortable of an experience as possible. I generally prefer to not use benzodiazepines for their because of the amnesia effects, and I want patients to be able to be as present and conscious as possible and not forget the experience. But given for it's hard to predict, but for people who've not had any kind of psychedelic or ketamine exposure, there is a higher likelihood that they may have some sort of intense feelings around exposure to the ketamine for the first time. So I want them to be as calm as possible. Then, apart from the medication, I also use something I call it psychosomatic support. So it's a customized playlist that gets used during the therapy session. And I also use something called vibrating touch points. So this is a tool that's used in EMDR therapy, which is a type of therapy that rapidly activates opposing parts of the brain and creates more of a parasympathetic relaxed state. And it's very simple technology. It's just 2 little vibrating pads that get held in each hand, and the patients just hold them, and it just creates this calm state. Works wonderfully, by the way, for anybody who does any kind of awake procedures. Yeah. I also use an eye mask, and then patients have this sort of custom playbook that the therapist has provided them of ways that they can recall things from their therapy session. Anything from, whether it's a mantra or a phrase that they repeat. I always have patients drop in about their intention and a word that they want to visualize once they're fully healed. And I come back to often share that with patients, especially early in the procedure as as they're first as the procedure's getting started, the medication is being administered.
So you're walking them through it, sort of
Totally,
exactly
yeah.
what you're saying.
So to
Okay.
kind of paint the picture for you, I the morning of the procedure, I go in and I do my usual pre-op protocol of just going over consents, the informed consent process, marking the patient. But then we drop in, I take out a little candle and I have the patients write their intention on the candle, which is something I want them to use during their recovery process to light it every evening or whenever they feel called to. And then we do a little meditation beforehand. I have a few words that I just kind of let it flow. I don't always say the same thing, but I will have received a debrief from the therapist what the sort of the takeaways and the intentions were, and
Right.
I try and work that into the meditation as a sort of guided experience. And then patients will walk to the operating table. It's still an operating room. It's not like a full sort of I'd say like a retreat center vibe. It still needs to be somewhat of a sterile space. But keeping that in mind, I try and make it as comfortable as possible. So I have music playing, I have the eye mask, I have actually a vibrating pad that gets that's placed on the bed, and patients lay down, have them put the eye mask on. I get them fully ready for surgery, prepped and draped and cleaned, and then the ceremony starts.
Okay.
And the ceremony is with that first IV dose of ketamine. And I wait usually at least 15 to 20 minutes. Um, I just want I want my patients, first of all, I want to see how they're reacting to the medicine so I can monitor their vitals, but also just to check in with them and see how deep they are. Ketamine is still a powerful anesthetic that has real physiological effects. So it's really important for me to not just give the medicine and then start the procedure. I just want to make sure that I can really keep patients in a state where they're able to communicate with me, but they're not so gone that I'm not able to check in with them.
Right. Right.
And in that first 15 to 20 minutes, I will do some recall of what their intentions were and some of the things. And I just let the music do most of the work. I try not to talk too much because that can I'm not trying to overpower or to really guide their experience more than necessary.
Right.
Yeah, so that's the brunt of the surgery ceremony protocol, and then I do my surgical procedure. I will at times redose with the IV infusion, depending on how first of all how experienced the patient is with any psychedelic or ketamine. Some patients have had previous ketamine treatments or any other medications that they take. And my goal is it's really this kind of conscious sedation anesthesia is really about keeping the patients in a comfortable liminal space where I can do the work comfortably, but also make sure that they're having a good experience.
Right. And are you finding that that's the general takeaway? Is everyone seems to be satisfied with the experience?
Oh yeah, it's been there's always learning. I've been doing this for about a little over a year now. I've had about close to 30 patients that have done ketamine during the surgery, and then the therapy component has been a newer thing that's been added recently. So I'm integrating all of that. And the takeaway has been it's been overwhelmingly positive for a number of reasons. First of all, during the procedure itself, um, patients are not having to be under general anesthesia, I think is a huge plus. I think, and I have a few slides on this, but there's research that shows, the trauma of general anesthesia in general, of having your consciousness sort of rapidly unplugged and plugged back in creates this discordance in the body that is challenging to recover from, especially if you've had surgery, because now this trauma has happened to the body and even though you're a conscious participant in the experience, um, after surgery, when your consciousness comes back online, people often have a pretty violent reaction, and it can be
Yeah.
challenging for the body to understand, like, I'm in pain, all of this physical trauma has happened, and now you're sort of left processing it. So I think being a conscious participant in the experience, and there's some interesting evidence around this, helps really mitigate some of the challenging effects of surgery.
Right. Which well,
Let
makes sense.
Yeah. This is something I was alluding to, is that the trauma of surgery, there's close to several millions of surgeries done a year around the world, is that the takeaway from this article is that an anesthetized brain is still physiologically awake and responding to the stress of surgery. So it's not even so much like the big picture is every day these traumas are happening, and these surgeries are necessary. People are having them, whether it's elective or necessary or non-elective surgery. It needs to happen. But this awareness that this kind of micro traumas are happening consistently, and that not just that, but wow, could every surgery experience be used as an opportunity to elevate and honor a transformation that's happening? Um, and this was to say that
Oh yeah,
again,
this
part
is
of the challenge
interesting.
of the general anesthesia is that it's frighteningly high, but potentially up to 2% of patients will have total awareness. I don't think it's actually that high. I think we'd hear about it a lot more often, but it can create some serious PTSD. Is to be to appear fully anesthetized, but to be present and awake to the situation is scary.
Yeah.
One interesting study I wanted to touch on is that a randomized trial assessing the effect of ketamine in surgical anesthesia for patients who have depression. So in this study, they basically screened for patients going into surgery that had evidence of a major depressive episode in the past 4 weeks. And they gave them ketamine after the anesthesia started. And what they noticed afterwards was there's actually no difference in terms of depressive symptoms. Meaning patients after having general anesthesia surgery and getting ketamine or not getting ketamine, both groups of patients had less depressive symptoms,
Interesting.
which is interesting. And that doesn't necessarily say that ketamine isn't doing anything. It's just saying that the experience of having general anesthesia and these medications is powerful, and it may be somehow creating an antidepressive effect. But what's more interesting is that in that paper, they comment that it's the conscious experience of having a ketamine dissociative experience plus psychotherapy is actually way more potent than other medicines. So it's psychotherapy plus being awake and conscious during the experience, so you can actually process and think through the things you're going through. And it seems to make sense. It doesn't, like if you're knocked out and you don't get a chance to think through and process the things that are causing your brain to feel
Right,
depressed,
exactly.
it's
Yeah.
probably less likely that you're going to feel an outcome afterwards. So yeah.
And so you've been doing this for a little over a year, you're saying. Are you noticing an uptake in the medical community? You know, people coming to you for, hey, can you tell us how you're doing this and how effective it is? And
I have had I've certainly had some interest from other surgeons that are curious about it. I think I still think it's quite fringe at the moment because it's really, it's threading the needle of a few small holes, which is, um, therapy before surgery is not a common practice. There are some plastic surgeons out there that work with therapists.
right,
And then furthermore, doing ketamine assisted psychotherapy, I think is even more unique, but I think it's a really potent tool because of how effective it is in a short time frame. And then ketamine is used during surgery regularly by anesthesiologists. So most of the colleagues I've spoken to are therapists and anesthesiologists who work in the ketamine therapy space, but not many surgeons. I've spoken to a handful of them that are curious about it. And I think the bigger takeaway from all this is that the community, the patient population that is seeking aesthetic surgery or reconstructive surgery has been greatly underserved from a mental health standpoint from a long time.
yeah,
Yeah. And I think taking the time to acknowledge that would wake up a lot more people in the medical community to do something about it, whether it's to provide therapy before or after procedures. But it is only very recently that I've started talking about and sharing it. So hopefully more people take interest and I'm so happy to share this because my vision and mission for this is that that every surgical experience be an opportunity for people to have a ceremonial or transformative experience where their mind is fully supported in the transformation of the body.
right. Yeah. And I tried to find anyone else in the space that was doing even something remotely similar, and I could not find anything.
Mhm.
So I'm wondering, are you the only one out here?
I think, I mean, I don't, the colleagues that I've seen that are doing something similar in the space, it's not like this, but they will work with a therapist as part of their team.
Right,
It's more for medical legal purposes to help screen patients and make sure they're good candidates for surgery and also to provide support. But as far as, providing a full protocol and approach, I do believe that this is unique in that way. This is the
right.
first time.
Mhm.
Yeah.
And then so you've done the process, you've walked them through, you've given them the, you've followed the protocol for the surgery ceremony process. What does aftercare look like?
Yeah, great questions. That's actually, I think those are my next slides.
Oh,
Oh, here I was just talking a little bit about the importance and evidence behind music and ketamine therapy. So the aftercare, in addition to the standard post-op protocol, which is, I see patients regularly, I reach out to them, we have our follow-up visits. I encourage all of my patients to get body work, specifically lymphatic massage. Can you still hear me?
yes, I can.
Okay, good. Just want to make sure. Um, the experience of having surgery and a really fundamental shift to the body is, the to bring the sensory awareness back into the new body is the idea behind doing the body work. So the third step, the third part of surgery ceremony protocol is body work and lymphatic massage.
Mhm.
And I work with certified lymphatic therapists that help patients not just with the physical aspect of the surgery, where there's a lot of evidence that it helps with anxiety and pain and specifically swelling related to the procedure, but it also gives patients this like it's like being held and coddled and hugged almost. Like the power of touch is really important. And in this setting, I also I alluded to it before, but we go back and we touch on the importance of the music and the playlist. And so patients um, in the third step of the protocol for the aftercare will listen to the same tracks again that they have listened to already for a few weeks in a row. And it hopefully will bring back some of the catharsis of the experience,
Right.
but also just help them really land in their new body. It's kind of like, I see it as like the real aha moment where everything gets integrated and fused in the somatic experience. Because
Right, right.
the surgery itself, even though my intention and goal is to make it as minimally invasive and not traumatic as possible, again, it's still a surgical experience and they're conscious during it. So they're able to be participants in it and be dissociated from the pain. But the lymphatic body work is, I think, where the whole experience comes to fruition and patients really get to arrive in their new bodies.
I love that landing in
Yeah.
their new body.
Yeah.
And I mean, it must be so nice and rewarding for you to be there in that aha moment for them too.
Yeah. Yeah.
It's incredible. And then, okay, so they go through this lymphatic massage.
Mhm, mhm.
They've got this is all included in the whole process, which is
Yeah.
explained beforehand.
Yeah. And
Okay.
there's been some interesting research. I had uh, specifically in the study on S and R ketamine and its efficacy for treatment of depression, shows that 3 consecutive treatments 1 week apart with ketamine really creates long-lasting neuroplastic effects. So the protocol is also designed in that way to space out the ketamine treatments such that it's like a full mental health reset in a way too.
Right.
Um, Patients don't always use the ketamine in the bodywork sessions, but it's something I'm curious about as a potential option.
Right. I was going to say, so what about the people that decline using ketamine? Have
That's
you,
fine. That's fine. And then
yeah?
they'll just do they'll have the surgical experience that I've been doing for years now. That's with different medications. But um, I think they're missing out on an opportunity. But I fully respect, like if that's not something they want to do, they don't do it.
Fair enough. Yeah.
Yeah.
So you are still offering, people who are just like, I'm just here to to get it done and get out of
That's
here.
right. Yeah, that's
Yeah,
right.
fair enough.
I
Yeah.
invite every patient though in the consultation process. I say like, hey, this is my take on this. This is why I do things differently. And I would say the majority of patients are open to it. Even patients that have never had any kind of ketamine experience before. And anecdotally, the responses have just been phenomenal. Like what patients are thinking, how they're feeling, and how they're seeing their bodies, and what the mental health experience is like for them afterwards too.
It's
Um,
incredible.
yeah,
Well,
and there and
sorry, go ahead.
oh, no, I was just going to say, and there has been some learnings too. This is, I would say, still feels like the early days of this protocol. So
Mhm.
there of the experiences that I've had, I think they've been overwhelmingly positive, but there have been some patient experiences that I learned from. Specifically, one patient comes to mind who had previous history of sexual trauma, and the experience of the surgery was difficult for her because it brought up a lot of the feelings and emotions that she thought she had either processed or addressed and weren't an issue anymore, and it actually resurfaced them. So on one hand, it was challenging, but on the other hand, it also creates an opportunity for her to do more of that work. So it really
Right.
truly is a ceremony.
Right.
Yeah,
So at the end of it, actually, here, I'm going to ask this question and then I've got another question for you after
sure.
this. So, Dr. Rodrigo Dominguez Milan, the question is, what's your opinion of a possible scenario of working with other psychedelic medicines aside from ketamine with surgical patients, asking also as a plastic surgeon myself?
Oh, awesome. Cool. Great to meet you. Um, wow, it's a great question. I think we live in a world where basically we have to function from the medical legal ethics perspective, and until there's um, enough research and evidence to support, first of all, legally and safely using any other kind of medicine in this setting, I think we have to hold off. Whether, if I understood correctly, basically asking like what other psychedelic medicines could be used in the surgery setting. Um, I think as a therapeutic adjunct before or after could be incredible. I think during surgery, I would, I'd proceed with great caution, considering it. I think ketamine, when I um, look at it as a medicine, I think it's like, wow, was it like the perfect medication to exist for this kind of experience? Because um, first of all, it's legal. Second of all, it's been used abundantly for decades in medicine. It has a good safety profile. Third, the physiological effects of ketamine are really favorable for awake procedures. So it doesn't, it slightly raises blood pressure and heart rate, but it doesn't dramatically affect breathing, and patients can really be kept comfortable. So it's like, that's already three reasons why surgically it's great. But then you start to get into some of the psychoactive and mental health benefits, and that's when it's really becomes like a slam dunk for me. So the proven benefits for anxiety, depression, PTSD, I think is really significant, especially because in the surgery patient population, it's a known thing that patients will often have depressed mood after surgery. So the fact that it creates this elevated mood is like, it's not helpful just during the surgery, but afterwards as well. And then finally, there's the more ceremonial psychedelic side of it, which is, oh, wow, at certain doses, ketamine has a different effect entirely. So at a low enough dose, it can just be mildly dissociative. And then as you get to higher and higher doses, it not only creates more of a psychedelic state, but you can really dissociate from pain. So it creates this highly customizable, legal, safe, effective way to titrate a patient experience so that they can have awake surgery and possibly ceremony. Like I can't imagine another psychedelic that fits that profile so efficiently. Um, and just to play devil's advocate, it's not, it's still a powerful medication that needs to be carefully monitored in a controlled setting with people with medical expertise and to have a backup plan. There is no like straight reversal for ketamine, but you need to be able to be prepared to intubate a patient if, they do go unconscious and can't protect their airway. So my answer after that explanation is I would love for there to be other psychedelics to explore in that setting. I just don't think, for a number of reasons that I mentioned, that we're ready to do that. The only setting I could imagine that happening is more in the therapy before after setting with a licensed therapist.
Another question right away. Hold on. Can you speak to some of the insights patients had while in that ketamine space?
Yeah, I'm going to share this next slide, which is these are literally excerpts that patients have either shared with me or things I remember from them. So I'm reading them verbatim, and I have permission to share this. So I'll just read them out. So um, this helped me break through past trauma that has inhibited my growth and potential. My doubts and worries for the procedure are gone. My body feels like home again. I feel like I can finally accept and love my body. I honestly feel a new type of excitement for not only the procedure, but the integration of all the tools that I gained from the experience and for the transformation that's yet to come. So
That's
these are
great.
just some snippets. Um, One of the more memorable experiences is a patient who had she had self-reported that she had lots of experience in ceremony and with psychedelics, but never ketamine. And her intention and word going into the procedure was love, self-love. And I remember as the procedure was starting and the music was playing, she just took this big deep breath in and let out this audible sigh, and she said, "I finally feel self-love. Like I finally feel it and I'm so ready for it." And then we started the procedure, and checking in with her afterwards was in the weeks after the procedure, the follow-up was incredible because she took no narcotic pain medication. She was up and about pretty quickly after the procedure, moving, and she called me a few times to tell me how good her mood was after the procedure. So not everybody is going to have an identical experience, but I think it is a testament. Consistently, I've been getting kind of reports like that. So less use of pain medication after the procedure, faster return to regular activity, and an improved mood.
And improved mood is something that we don't really talk about very often. Is that post-surgery just
Oh yeah,
complete, right?
it's a known thing. I mean, there's a known thing
Yeah.
called the plastic surgery blues, which is
Mm.
patients, and I mean, it makes sense. You're in pain. You've taken time off work. You've probably spent a bunch of money, and you're not seeing the results yet. And you actually probably look worse than when you started. So most patients, well, plastic surgery blues is a known thing, but I think in
Mhm.
general, blues after surgery or having depressed mood is common. So any way that that can be decreased was I think is a benefit, especially because this is something I wanted to touch on. Let me find the slide a little earlier. Um, there's a plastic surgeon in the 60s who wrote basically a pop psychology book at the time called Psychocybernetic. And he has a statement. He says in the book, when you change somebody's face, you almost change their person, their behavior, and sometimes even their basic talents and abilities. And what he noticed in his studies of patients is that patients that had a positive mood and mental attitude about their entire situation and the procedure were always happier with their results and just had a better outcome. And I think this kind of approach to surgery also it tries to address that, which is, how do we create a safer mental framework for patients to operate in and exist in as it relates to their surgery. So um, to not have any fears or doubts going into the procedure or have any regrets or shame or anxiety after the procedure.
Right. Hold on, there's another question here. Working in cardiac surgery in which every patient undergoes a GA, would there be any parts of this protocol that could be used/applied to reduce the trauma associated with such an invasive surgery?
Mm. I think the parts of this protocol that could still apply would be before and after therapy. Um, was the therapist using ketamine? I think it could be really powerful. The study that I showed earlier, I can pull it up again, where they actually used ketamine during the surgery, showed it wasn't necessarily more effective than just using general anesthesia, which just goes to show that maybe there's something in some of these general anesthesia medications that helps cut some depressed mood. But the part of the protocol I think would be the most useful would be doing some sort of integrate preparation for the surgery beforehand with a therapist and ketamine or afterwards. Keeping in mind that cardiac surgery, it would be good to have an anesthesiologist on board to make sure that or the cardiac surgeon to clear a patient for the use of ketamine, even though it's technically has a much safer cardiac profile than most other medications. Just to be extra safe.
Right. Thank you. Let's see here. Oh, my screen doesn't want to go down. Sorry about that. Okay, so then we've got this whole, I think you've painted a really visual picture of what it looks like from start to finish. And then, with people's testimonies and testimonials coming back saying like this has just been clearly life-changing for them. Are you noticing, I don't want to use the word uptake, it sounds too sterile, but are you noticing, larger, groups of people coming to you and saying, hey, we'd love for you to come and train our physicians here at the center, at this plastic surgery, unit to do the same thing that you're doing there?
Yeah, I've shared the protocol with a few surgeons, but I'd say like I'm gonna be honest, this is probably the first time that I'm publicly speaking about this in this
Oh,
kind of format.
interesting.
So this is
Okay.
really the debut of surgery ceremony. I've shared about it a little bit on social media and on podcasts and things like that. But as far as demonstrating this protocol and sharing the early insights so far, this is the first kind of formal way of doing it. It's just been word of mouth so far.
Okay.
So to anybody that's listening that wants to know more, I'd be super happy to share and discuss more about it. It has been an iterative process. With every patient, I learn more, and it's felt like a very safe way to explore this protocol because no individual part of it is um, is how do I say this? It's not no individual part of the protocol is unique. Ketamine assisted psychotherapy has been around for a while. Ketamine has been used in surgery for a long time, and body work has been around for a long time. But it's the synthesis of all three with the intention behind it, which I think is what's more unique in this setting.
Right. That makes perfect sense, though. I'm very happy that you chose this platform to to be the birth of the surgery ceremony protocol. I
Yeah.
love it. That's great. And now, are you getting a long line of people that are, sort of beating down your door to say, "Hey, I've heard you're doing this, and I'm really
Yeah, I've definitely had a lot more interest. I would
right,
say it's still, there's so much momentum in the surgery world, specifically in plastic surgery, about certain things being a certain way that when something is new, people like it's almost like I guess it's like any new procedure or product or anything like that. It's like needing to explain why somebody might benefit from it.
right,
And in order to do that, first you have to explain what the problem is. And it's in consultations, it can be it can definitely be an interesting experience when a patient comes to me not knowing that this is something that I do, and I start talking to them about mental health
right,
and the intentions and reasons behind their surgery. But more and more patients are coming to me knowing that I practice what I consider more of like a holistic side of plastic surgery, and they're seeking more of that kind of experience. So I would say the popularity is definitely growing in that sense. Like people are already coming to me knowing that this is kind of the experience that I provide. But I still try and share as much as I can to hold space for somebody that might want or benefit from honoring the transformation of the mind as well as the body.
right. And
Yeah.
I love that you said that you're known for sort of a more holistic approach because I know people are looking towards that. Traditional ways of receiving procedures is, I think, tried and tested, and people have been, fed up with what is currently going on, right? And I have a feeling, and I want to see if you can confirm. I have a feeling, though, that no one would really be surprised to know that you have landed in this space. Have you always been sort of like a trendsetter or holistically speaking, sort of attuned to providing a whole different vibe when it comes to how you're delivering medical care?
It's been a labor of love
Right.
to finally land in this space because for a long time in my medical training, residency, even early years of practice, I struggled with the feeling that not all parts of me were being able to be present to have an
Right.
authentic
Wow.
experience in the way that I was aligned in my work. So, um, and struggle might be a strong word, but it didn't feel like I could show up every day in full alignment, no matter how much I tried to show up and just be the fullest, truest me. And that's because
Right.
there is, to be totally frank, there are a lot of dark sides to the plastic surgery industry. Just gonna say it. For to not acknowledge a lot of the mental health issues that patients work with and just strictly focus on the body as a tool to change the psyche creates a lot of problems. And that's specifically why I shied away from doing breast implant surgery. I stopped 5 years ago. I had
Okay.
patients coming in that were really suffering from their breast implants. And that's not to say that everybody who has a breast implant is going to get sick or have a bad reaction, but there was a statistically high enough number of patients, as high as like about 30% of patients that were having problems with their implants. And I was like, I can't predict who these patients are, who's going to get sick and not. So I'm just going to step away from it completely. And that kind of started the journey into trying to figure out a more holistic way of doing things. And that's when I started focusing on fat grafting as an alternative to breast aesthetic and reconstructive procedures. And then it's just been, the experiences in my external life, whether it's travels or just other spiritual experiences, that kind of keep coming back to ways to integrate this into that experience. And surgery ceremony has for me has become the place where all of that kind of where it gets synthesized, where I can say, wow,
Right.
I can bring my spiritual holistic self
Right.
to the world of medicine that is evidence-based and not um I should say this carefully, but like not too woo-woo, because there are those parts of medicine that like there's just
Yeah.
not we can't fully speak to the evidence behind. Also keeping in mind that I have not done a randomized controlled trial on this. There's a lot of evidence that and research could still be done in this space, but it really feels like it allowed me to express all parts of myself in a way that that aligns and gives patients the best experience possible.
That's so admirable. I have so much respect for that. It's just
Thank
not
you.
too many of us get to wake up and do that in alignment, right? And even recognizing what that alignment even looks like. And actually, here I've got a comment from Lola saying, "Wow, you are providing your patients with a tremendous gift. Thank you for being a brave
uh
pioneer."
thank you, Lola.
Very, very true.
Yeah.
It's
Yeah. My hope is that the given the number of surgeries that are done every year,
mhm.
I think at the latest stat I looked up was something close to 300 million around the world, which is just a lot. I need to double check out that, but I was blown away by that number. It's for sure in the millions. Um, to think that if this kind of intentionality was brought to each, so anyone that's listening that's had any kind of ceremonial or journey experience, I want you to just like just remember a recent, if you've ever had one, just remember a recent journey or medicine experience. Now, imagine a world where you're going to an experience, but you're not being told it's a journey or an opportunity to be in a journey to transform. And that's happening millions of times a day. So like to me, it's almost as if there's millions of people out there that could be setting an intention and having a transformative experience around a really important event that's happening in their body, whether it's surgery for a broken limb, arthritis, heart surgery, cancer. Like these are major physical ailments that are creating a psychological uh, difficulty in the body. It's really hard to not be able to walk. It's really difficult to live with a damaged heart. Cancer causes so much psychological difficulty. So to think that there's this experience that's happening thousands of times a day for patients on an individual level, that some level of intentionality could be brought to honor that transformation. And it doesn't, like, what could be done today? It doesn't have to be a whole ceremony experience in the operating theater. That's like, that would be a big, really big ask to ask of the current medical system, especially a lot of the people that work in it just don't think that way. They're just not aware to
Right.
it. But even
Yeah.
something as simple as just dropping in briefly before a patient undergoes anesthesia, or having a brief intention setting moment of what somebody wants to feel like afterwards. Even that, to me, is the very seed or beginning of what surgery or ceremony could be.
Right.
And there's so many ways it could go, but um, for the audience, I just hope that this idea could be sparked, that wow, out there every day there's millions of people that are undergoing a ceremony and don't even know it.
Right.
And it is an opportunity for them, for anybody who's in the caregiving space or in the peri-surgical world, before or after surgery, to honor that transformation. And I think doing that with intention creates a totally different outlook on what surgery is.
So does all this intention and, you know, ceremony and just the emotional taxation of it all, does it ever come back to you and you're like, I am so drained? Because while
Oh,
you are, guiding people, it takes from yourself, obviously, right?
absolutely.
Yeah.
Absolutely. I think there's a reason why many surgeons don't like to do awake procedures, is because they're just apart from um, some of the technical elements, it's like it's really challenging to hold space with somebody while they're awake, because it's not like patients you're trying to create an environment that facilitates their comfort and hopefully even more so a transformation. And there are times that are uncomfortable. Like imagine somebody is crying or wanting to process something, and you're trying to do surgery, so like
Hmm.
it takes a lot of patience in a sort of way of going about it. um and to be honest, it is very draining, not just physically but also emotionally, to hold space. And so I try as best I can to just really protect my emotional sphere as I go through this. A lot of restorative activities as much as I can.
That's good. I think it's also, I think it's really important to describe that other side because, when you are a pioneer in your space or you're doing, the first of something that's really rooted in such a deep sense of, wanting to help people, um, land, I guess, for lack of a better way to say it, to not acknowledge that the taxation on that, the empathetic side of you that you
Mhm.
have to be to go ahead and do that for each journey has got to be
Mhm.
exhausting. So I'm glad. Thank you for being so candid.
Thank you. Thank you. It's made a lot easier in this setting with the amazing help of the rest of the team I work with. So knowing that patients have great body workers, certified lymphatic therapists to work with afterwards really helps because they don't just hold space physically, they also talk with the patients and guide them through the experience. And also the therapy side of it is just invaluable. So working with Dr.
Mm.
Meyer is just like, it's just honestly the biggest blessing because I know before patients are cared for and held and after they can be cared for and held if they need it. So I'm not alone in supporting the mental health of patients.
Right. It takes a village,
Yeah, exactly.
right?
Yeah. Yeah.
Well, I've got a closing comment here that I think is actually really impactful and a perfect
Mhm.
way to close off. It's Brendan Lear.
Mhm.
Having worked in a big acute care hospital, hearing from complex post-surgery patients, there are so many ideal candidates who suffer after life-saving but incredibly invasive procedures: ENT flaps, bariatric surgery, palliative surge, VAD, oncology, etc. All of these folks would be ideal for these interventions in part or whole, but it is unlikely that a protocol like yours would ever arise from these services. Thanks for taking the responsibility to focus on such meaningful work. You are honorably continuing the meaning of work of the first plastic surgeons like Dr. Tilly, who I owe my existence to, as he did a flap on my grandfather. Oh, wow, interesting. A member of the Guinea Pig Club in World War II.
Oh, wow.
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 Thank you for sharing that.
Thank you. I've got goosebumps hearing that. That's
Yeah,
very, yeah.
same.
Yeah.
So
Um,
I can't thank you enough. I was fascinated when this first landed in my inbox, and of course, I told you earlier I went and immediately started checking you out on um, Instagram and seeing what the kind of work that you're doing. But getting to speak to you and connect all the dots was just really, really, a great space for me. So I thank you so much for coming, and thank you so much for being so open and intentional and candid and all of the things, all of the great things.
my great pleasure. Thank you for hosting me. It's an honor to be able to share this for the first time with everybody. And
Oh, so
if
good.
anybody has questions, please, actually, maybe I'll type my email and Instagram handle in the chat.
Oh,
But
that's a
please
great idea.
feel free to email me. And
And I'm
I
sure
have
we're going to be seeing
my
a lot
Instagram
more of
handle there.
you.
Yeah.
There it is. Perfect.
Yeah, so you can follow me on Instagram for more of this information, or feel free to email anytime. I'm always happy to chat and share more about this. Thank you so
All
much for
right.
hosting.
Thanks. Thank you, everyone, for joining. Have a good evening.